Welcome to Medical English Buddy. I'm Eric, your English learning partner.
And I'm Professor Buddy, a nursing professor. I'm here to help you speak with confidence in any medical situation.
Professor, I'm literally shaking today. I saw a video of someone with kidney stones and he was in so much pain. Is it really that bad?
It is. In the medical world, it's often called the king of pain. It's known to be one of the most intense physical pains a human can experience.
Oh man, I don't think I could even speak.
That's why we're here. When the pain is that intense, you can't say long sentences. You need the exact words. Let's look at the first scene and see how to describe the symptoms when you first arrive at the hospital.
Sir, please try to breathe. What's the problem?
I have a sharp, stabbing pain in my back.
Does the pain stay in one place, or does it move?
It's radiating down to my groin. I can't sit still.
I understand. I'll get a doctor immediately.
Please, it's a 10 out of 10 pain.
Stabbing pain? Does that mean it feels like someone is actually stabbing me with a knife?
Exactly. We categorize pain to understand the cause. Stabbing, or sharp, means it feels like a needle or a knife. It's very different from a dull ache, which is more like a heavy, constant pressure.
Dull ache versus stabbing pain. Got it. And what about radiating?
Think of it like a path. The pain doesn't just stay in the back, it travels or spreads along the nerve path. For kidney stones, it commonly radiates down from the back to the lower body.
Radiating down. It's like the pain is on a road trip. So what happens when the doctor finally arrives? Let's check scene 2.
I'm Dr. Kim. I'm going to tap your back gently.
Please be careful. It's very sensitive right now.
Does it hurt right here?
Yes, that's exactly where the flank pain is.
It sounds like a stone is moving. We need a test.
Anything, just make the pain stop, please.
Professor, I mentioned flank pain. Is that a common medical word?
Very common. The flank is the side of your body between the ribs and the hip. In a hospital setting, this word is used specifically to check for kidney issues.
So if I say I have flank pain, will the medical team know it's my kidney?
Exactly. It's much more precise than saying, my back hurts. It helps the staff focus on the right area immediately.
Wow, using flank makes me sound like a pro. Now let's see why they need a sample in scene 3.
Here is a cup. We need a urine sample.
I'll try, but it really hurts when I try to go.
Have you noticed any blood in your urine?
Yes, it looked a bit pinkish this morning.
That's a classic sign. I'll take this to the lab.
Is that why it hurts so much to pee?
Pinkish? That sounds like a nice color for a shirt, but not for, you know.
Definitely not. Even a tiny amount of blood changes the color. The medical term is hematuria. It happens because the sharp stone can scratch the lining of the urinary tract as it moves.
Ouch! So the stone is like a tiny, angry rock with sharp edges.
Precisely. That's why the color is such an important clue. Pinkish, reddish, or even tea-colored are all used to describe blood in the urine.
Blood in my urine. Simple, but very serious. Wait, the patient is in trouble. Let's go to scene 4.
I can't take it anymore. I understand. We're giving you strong meds through your IV. Please tell me, will it work fast? Yes, it should kick in within a few minutes. Thank God, I felt like I was dying. Just breathe slowly. The medicine is starting now.
Kick in. I love this expression. It sounds so powerful.
It is. In the ER, patients always ask, when will it kick in? It means, when will I start feeling the effect of the medicine?
Can I use it for other things? Like, when will my coffee kick in?
Actually, yes. It means to start having an effect. But in a hospital, it's a very common way to talk about pain relief.
It will kick in soon. That's the most beautiful sentence in the world when you're in pain. But what if the stone is stuck? Let's check scene 5.
The stone is large. You might need a procedure. A procedure? Does that mean I need surgery? Not necessarily. We can use shock waves instead.
Shock waves? Will that crush the stone?
Yes, it breaks it into tiny pieces you can pass. If the pain stops, I'm ready. Let's do it.
Shock waves? Is the doctor a superhero?
It certainly sounds like it. The procedure is called lithotripsy. It uses sound waves from outside the body to crush or break up the stone into sand-like pieces.
So no cutting, no surgery?
For many, no surgery is needed. Crush the stone is the key phrase here. It makes the stone small enough to pass through the system naturally.
Break it up and crush it. Simple English for a high-tech treatment. Now, how do we prevent this from happening again? Scene 6.
You're feeling better, so you can go home now. Thank you. What should I do to prevent this? You must stay hydrated. Drink 2 to 3 liters a day. I'll drink a gallon, anything to flush out the stones. Good. If the pain returns, come back immediately. I'll keep my water bottle with me everywhere.
Flush out? That sounds very mechanical.
It is. Think of the kidneys like a filter. Without enough water, the filter can get clogged with minerals that form stones. Water flushes everything out.
So stay hydrated isn't just for glowing skin.
No, it's the #1 way to prevent kidney stones. Hydration is truly the best preventative medicine.
I'm drinking water right now. I never want to feel that stabbing pain.
Good choice. Let's wrap this up with our survival sentences.
Let's lock these in. I have a sharp, stabbing pain. The pain is radiating to my groin. It hurts in my flank area. I see blood in my urine. When will the medicine kick in? I need to flush out the stones.
Excellent. These phrases will help anyone communicate clearly in an emergency.
Stay hydrated, everyone. Drink your water.
See you in episode 4.
Bye.